I started in November from a medical assistant. I never decided to go to college until I started taking care of my great grandma. So that kind of opened the door for me. And so I decided to do medical assistant as my first step. And it's been a rough battle, though. My great grandma, you know, showed me the path of my life, and she passed not even 2 weeks ago. So that was a tough battle. And then I'm sure y'all having tough battles in school as well. I heard some complaints about questions and everything. Well, it's going to be hard for a long time, but you just got to keep pushing through it, and y'all can do it. It's not impossible. Every stepping stone there is, all you got to do is jump over it. Um, it was, like I said, it's a long battle to go through, but everybody can do it. You just got to put your head towards it, and you can go. So the externship, it was great. They were wonderful to me, and that was also the time that my great grandmother passed. So they were really sincere and considerate about the time that I took off. So I mean, as long as you do your best, you put your best effort, they're gonna make it great. They're gonna be. I can use everybody there for references for jobs, and if y'all just do as best as y'all can do, it'll be the same way for y'all. There's, no doubt that nobody can't succeed in doing anything that they set their mind to. You just got to push forward and jump over every obstacle. So, do y'all have any questions?
What was a typical day at Premier Healthcare Associates like?
So when I first started, I shadowed my first couple of patients in the first couple of days. Then it got to be I got my own computer, had my own login. I wouldn't, call the patients back, took their vitals, um, checked the medications, any allergies, any, like, if they need any refills, any complaints that they have, sent the doctor's flags for any of that. I worked with all four rheumatologist doctors and the one primary care doctor a couple of times. So, and then after the patients left, we cleaned the tables off and we get ready for the next patient. And it was just, constant, constant, constant. And then I worked in the lab for one day. It was, working in the lab is completely different than in here. I can tell you that. Like it's so different. And it's very fast paced. Like you can't be fiddling around with your stuff. There patients in there, 30 seconds to a minute, they're out, they're gone. And you can be drawing anywhere. The most tubes that I drew off one person was 9 tubes of blood. So you gotta learn how to work with your tubes very quickly. And then in the fusion center, I think that was probably my favorite. I worked in the fusion center for about 2 weeks. And the infusions were for people with like rheumatoid arthritis and stuff. So they got Remicade, Rituximab, Timra, Orencia, numerous medications that went into IVs. So I got out all the supplies for the 2 nurses. Some of the patients had ports, which was in their main veins. So I got to clean the areas for the ports. And then they showed me how to calculate how much fluid to take out the bags, mix the medications, and insert the medications in the bags. I get to pull out the IVs, and I got to, hang a couple of the bags and connect the IVs to the lines a couple of times. But I was never able to insert them because that was out of my curriculum. But other than that, that was in the infusion center. Sometimes, like the last day I worked, like 5 people walked in like all at once. So it was, rushes, and then it was quiet times, and there's a lot of more patient interaction with the infusion center because some of the patients there for like 5 hours for their first infusions. So you just got to be, really patient. You got to learn how to talk to patients and keep them comfortable, and just have a conversation with them. So.
What classes really prepared you the most to go to Premier Healthcare Associates, and maybe what department, when you were at Premier Healthcare Associates, kind of coincided with which particular class?
The class mainly was, infection control, because that's number one. You got to constantly wash your hands, change your gloves, clean your area. Phlebotomy, of course, because that teaches when I was in the lab to draw the, blood. And then I forgot which the class. Many of the clinical classes all kind of combine. And then I didn't do too much, of the administrative side just because they have their own things that they do. But you definitely have to learn how to work at EHR because you're constantly going in there, refilling medications, correcting data, all kinds of stuff, inserting new medications or taking them out, changing the dosages. There's all kinds of things that, you do on a daily basis that you wouldn't think, it's not as easy as what it seems to be. So many of the classes definitely helped out at the externship.
Okay, good. What about your certifications? As I told the class, you earned pretty much everything there is to earn on campus, and I know you're going to sit and, get the rest of the certifications as well. Tell me, what was your approach to earning the certifications?
You just continue to look over your notes, review the study guides and stuff, and constantly, just pull your tubes out at any point in time. If you're doing your CPT, just pull them out and put them in order and say to yourself, what they're for, the additives, what the EKGs, just point to where the leads go and just constantly review it in your head. But you cannot stress yourself out the night of or the day before, because I never looked at my study guide the night before or the day of. I never did, but I passed okay. So y'all can't stress yourselves out over this stuff. Just just have confidence in yourselves. Y'all can't, just believe that y'all can do it without any hassle. Do not stay up, till 2 o'clock in the morning studying for the certifications, and then you'll get so upset if y'all happen to fail it, thinking that y'all spent all night long studying, but that's what hurt you the most, is staying up that late studying. So just think as an everyday class. Just don't even think about it as a certification, because I know that's what makes me nervous is when I'm taking a test. I just have to tell myself it's not a test. It's just, knowing what I know.
So basically what you are saying is do all of your preparation well in
yeah.
advance.
Oh yeah,
Stay
much in
with
advance. You cannot frame it all in. You cannot do that. And don't second guess yourselves. If you click the first answer, do not go change it, because most likely you're going to change it to the wrong answer. So just go with your gut instinct and do not second guess yourselves. And just take your time, just stay relaxed. It's not the end of the world if you don't happen to pass it. You can always take another time. But it's wonderful if you pass it the first time.
What was the toughest part of the CPT exam?
A lot of the infection control, because that has a tendency, it can kind of throw you off a little bit. So definitely study your infection control. And there's a big part of infection control on the CPT.
Okay.
So that's the number one thing to definitely, review on.
Okay. What about order of the draw?
Yeah. Infection control and then order of draw they were the top two. And then, the patient interaction, stuff like that. There's a few questions on that, but not too many. So you definitely have to, and then your additives, you got to know your additives as well,
Right.
and what they're drawn for.
Right.
So
Good.
a lot of your basics is definitely going to be on the certification.
Okay. What about for EKG? What would you say was the most important thing for the EKG certification?
You need to know your rhythms, your rhythm strips, and you have different rhythms. Every rhythm's gonna be on there, and it can definitely throw you for a loop. I mean, the interaction and stuff like that wasn't too big. You had a few questions about the placements and stuff, but you have to know how to read your strips and know, your AV node, SA node, everything. You have got to know your parts of your heart and what the electrical activity is reading in your note. In your strip. So you definitely have to study your strips for that.
Good.
And
Alright.
know your vocabulary, because they'll throw in similar words and throw you off.
What about from my students? Anybody else have questions besides me for Victoria about externship or certifications or anything in general about her education here at ECPI now that she is a graduate of ECPI University?
Have anything?
What about the filling burden?
I have not taken that one yet. No.
Students can continue to take their certifications after they graduate. You would still be able to qualify for the discount even after you graduate from the university. That we understand that it may be tough to get all 7 of them in 15 months. So we definitely want to encourage you to make sure you stay with the material and come back and earn all of the available certifications.
Anybody else?
All right, well, thank you so much.